Welcome everybody to Report Out for this week. I'm Claire Smith, Chief Operating Officer and Deputy Chief Exec. Phil's on annual leave at the moment because otherwise he would never miss a report out. So thank you very much for joining. We've got one report out today, which is from Facilities, our ward kitchen dilemma, and I can see a number of faces on the call. So Dean and Tracy and I think, yep, have we got David as well? Yep, there we go. So I'll hand over to you and then we'll take questions at the end.
Okay, thank you. So for those that don't know me, I'm Dean Head of Facilities at Leeds, and we're here to share our lead improvement method story. And as Claire says, I'm joined by David Smith and Tracy Hawksworth, who also work in facilities, and I think there's a member of the housekeeping team sat there with Tracy. As you can see, we've given our work title, which mainly links the facilities team with a challenge that's connected to the J14 and J15 kitchen activities. From me setting the scene a little bit, you'll hear briefly some of the emotions from the team, which there's highs and there's lows in this story during this challenge that we faced, and I have to say we continue to face. And you're not going to hear a golden bullet, and what I mean by that is I'm not going to sit here and say that there's one single intervention that we think was or gives us the answer to this dilemma. And any improvement is a combination of efforts from all the team, not just from facilities, but from the nursing teams as well. This report out does centre around the kitchen particularly, but there's also a link to other parts of our work, such as the SIM HPV programme, which is, for those that don't know, room fogging decontamination in terms of what it does, in terms of definition of HPV. As a team, we felt this challenge was very different from what we've seen and faced before, and we've used the lead improvement method as our go-to approach in confronting to this specific challenge. We've asked ourselves, does it fit with the Trust's 7 commitments? We do, specifically the HCI agenda. And as you can see from the slide that you're looking at there, we're currently members of an outbreak, an open major outbreak within the SIM CSU. The definition of CP is on the screen, which really is the focus of the outbreak, which started last year in 2003. In February this year, 88 environmental swabs were taken from in and around the ward, and these swabs, some of them returned as positive. 3 of these swabs were directly taken from catering items, as you can see on the screen there, which are patient trays, teacups and buckets, all in and around the catering activities. There's clear evidence of an underlying issue which we needed to respond to. When the swabbing results did come back, it meant we had to do something very different to what we've done before. In terms of the morale was low straight away, because we're thinking, what are we doing that's affecting our services on that ward, particularly in response to the CPE outbreak. The kitchen challenge was obvious to most people because you could see it was a shared ward and we were doing 3 meal services a day, which is approximately 180 meals, including breakfasts. So very small for 2 wards, very different to what we had before. So we used LIM as our primary approach to this. And what I mean by that is we had catering equipment that clearly splashed by nearby water outlets. We applied the 5 S's. We sorted, we swept, and we standardised equipment. And there were some really easy wins just by going out there. So we all went on as Gembas. I've tried to set the scene because it is a little bit confusing and juggled around in terms of water safety, CPE and HPV. But now I've set the scene, I'm going to hand over to David, who's going to share the actions in terms of what we actually did to confront this challenge.
Yeah, thanks, Dean. Hi, everyone. I'm David Smith, Deputy Head of Facilities. So, like Dean mentioned, we developed multiple actions using the LIM principles and undertook a series of detailed time observations on some of our catering routines and completed a series of successful small test change. We implemented twice weekly huddles, applied the 5 whys to better understand some of our catering practices, such as asking, why do we take 38 cups around a 28 bedded ward is one that springs to mind. We were always respectful. We kept staff up to date with all relevant information in regards to the major outbreak progress and found constant engagement with staff to be very important, which I know goes without saying. For example, during our Gembas, we actively spoke with staff, engaged and supported them. If staff asked for something, we tried to support it, and sometimes this came from the facilities huddles. They asked for a better designed catering trolley, which limited exposure to water splashing in the kitchen and remove the risk of wastewater directly entering catering equipment other than the shell of the trolleys, which could then be later cleaned. We shared some very bespoke water safety training. We developed a LIM visual management water safety out of action notice, which we've expanded to all clinical areas and written a standing operating procedure for. The purpose is quite simply stop any water outlet being used when faulty and take it out of action. In the kitchen, we wanted to keep at least a 1 metre free splash safe wastewater zone. And the biggest visual change was using the 5 S's is that we totally swept, sorted, simplified and everything and standardized what we used in the kitchen to remove any variation, because sometimes different crockery and cutlery can creep in. Self-discipline was the easiest part, which you can see on the screen. We applied and tested a range of LIM methods, especially around our bathroom cleaning regimes, working with the nursing teams. What we've learned is that when we go out and see on the Gembas, sometimes the things you see are very obvious, which does then invite further questions. So progress, if you refer to the data, we could have gone back further. However, we have taken it from November last year. I hope from what you can see, there is a positive response from the SIM CSU broadly, with a helping hand from facilities and other services. The main message, I think, is for facilities, when those sample results came back in February, we knew we could not always do what we've always done, because we would always get what we've always got, which we know would not have been good enough for our patients. When I last checked in mid-May, there were 82 patients included in the outbreak in terms of pure scale for the whole CSU. With our LIM training, we got straight into it and applied our LIM approaches in February on these 2 wards, which I think shows a combined multidisciplinary team effort with a range of interventions. So Dean mentioned the highs and lows in terms of emotions. This is true. The evidence told us that some of our equipment was positive to CPE, which gave everyone involved a real motivation to get this right and do better for our patients. And we know there is more learning to come from this specific bug. The Leeds Way values is at the heart of this work. Everyone had a sense of purpose and wanted to work as a team, including healthcare workers, non-clinical staff, and the commitment was literally incredible. We worked with the SIM CSU nursing team to supplement the whole CSU with a proactive HPV program that maximised the use of our current system and resource. And as you can see, the numbers are impressive. The new HPV technology the Trust invested in means we can do quicker HPVs with better supporting data too for every process. In general, making any changes was extremely easy and staff were quick to make all kinds of suggestions at the huddles and during the waste walks. Dean mentioned there isn't one singular intervention we believe made the difference. We suggest it's a number of factors, with many coming from the IPC team, including patient screening on all admissions and cohorting. One of the biggest tangible removal of non-annual value-added waste from this exercise centres around the afternoon drink service and reducing some of the communal catering equipment, which now Tracy will explain.
Thanks, David. Hi, I'm Tracy Hawksworth and I'm the Facilities Manager on Gledar Wing. And at the side of me is Sophia, one of our housekeepers from J15. There are some things that we would do differently. And looking back, we do need to take better advantage in future of all the increased HPVs that we've been doing. There's a lot of opportunities there that we'd place items in that we wouldn't normally ordinarily place in the room when a HPV is in process. For example, is some floor care machines, cleaning trolleys, catering trolleys, patient shared equipment, and it did give us a lot to think about. We know we are doing well, but it's an area that we can do even more. As you can see on the slide, when we was completing our waste walks to reduce the pieces of catering equipment that we were taking out on the ward, we realised that we could easily remove so much waste or unnecessary activity. A key example of this was, like David mentioned, the patient hot drinks round at 3 p.m, when a fair few of our patients were either sleeping or they just didn't want a drink at that time. As a team, we were preparing 28 drinks that were not needed, and we was also taking 38 cups out on the ward. We all saw that we could reduce the equipment taken out on the ward, and the drinks time is now also 33% quicker, and that's just in time alone. The figures and the removal of the waste is there for everyone to see on the screen, and this is just on one ward. Imagine if the impact for 12 months, if we could do this across all 10 wards for the removal of the non-value added waste. If we did do this on the 10 wards, just from the 3 p.m. drinks round, we would save 3,650 pints of milk a year, or 480 hours of not using the dishwasher, which is greener for the use of the energy. If we do this, it's also easily sustained and it's actually a lot easier for all staff. We as a team, we need to reserve time to proactively go out and see, not just in responses to situations like this. The kitchen design in Gledow generally remains a problem, and there's no other way of saying this, but we can work more smarter with what we have. Not always is the most drastic answer, such as new kitchens, is going to be the solution. We now know that we can approach things very differently with a Leeds improvement method approach. The photo that you can see on the screen would never have been possible earlier this year before we reduced stock and equipment. We created space, we used and applied the 5 S's, and we have been sustaining it, and I am very proud of our team. I just want to thank everyone from the SIM CSU so far. This has been a real collaboration, and I know that there is still some work to be done. Thank you all for listening.
Thank you so much. Could you drop the that last screen? Thank you, just so I can see some faces. That was absolutely excellent. And I know Craig is in Merrion House today at a meeting, so hasn't been able to join it, but I know he'll watch it watch the recording. But I'm messaging him saying that absolutely brilliant piece of work that's gone on here. I actually feel I just feel really proud. I mean, what an E&F team to really pick up the baton in this way, and working with our clinical teams in that real sense of partnership to reduce those harms and to own that in such a way is, you don't find that everywhere. And just excellent. Jessica, I can see you've got your hand up.
Thank you. Thank you, Dean, Tracy and team. Yeah, I just wanted to say a couple of words to echo you, Claire. So this is extraordinary work, and it's extraordinary. The curiosity and collaboration that we have through our infection control processes has been remarked upon by many people that visit our organisation, including the UK HSA, as extraordinary. And your team is very much centred to that amazing process that we have. The other thing that's extraordinary, as you say, is that this work has really been an absolute backbone to us turning the corner of the CP outbreak, which is now thankfully very, very, very much reduced from how it was a few months ago. And we're really hopeful we're nearly at the end of that outbreak, and this work and the work that you've done with the Karcher cleaners has been phenomenal. So we are so grateful as an IPC team and so impressed by you. I just also wanted to say that this work in the kitchen IPC, it's not something that you can get in any book or guidance, but the water safety that we've learned and shared in Leeds, and this next step that you've taken through this work, will be shared nationally. We are now the centre of water safety from an IPC point of view. We're being asked by people all over the country to share work, and certainly I'll be asking you, Dean and Tracy, to come with me to share this, because this water safe kitchen practice is very new, it's very innovative, and it's very important for patient care. So thank you. Sorry to talk too much, I'm just very excited.
No, I know exactly where you're coming from, because there was just so much in there, and said in such a sort of this is what we did kind of way, and it's what you did was outstanding. And I was thinking, with what you've just described there about the commitments, it's not just about the HCAI, it's the research and innovation, it's all of those things, and reducing the timeliness of care, because if people don't get HCAI, don't get a HCAI, their experience in terms of hospitals, their outcomes, it's just the whole shebang in terms of improving the experience for our patients, and it's just a massive well done. I'm keen to hear if is it Sophia? Apologies. Just keen to hear, how does it feel to work? How does it feel to work in the kitchens now?
Better, please.
Yeah, is it better? I bet when
Yes,
it's not so cluttered, it's easier to find things as well.
Yes, please.
Yeah.
Because we've got a new trolley, so we put everything in the trolley. So when we are going out, we just take a few.
Yeah, it made me smile when David said we've got a 29 bedded ward and we're taking 35 cups round, and that did make me so yeah. So well, thank you for all of that you've contributed towards that as well, because it's not just doing the work and planning the work, it's then doing it on a day-to-day basis and the consistency. So please pass my thanks on to you, but your colleagues as well. Just really, really well done, and you should be very proud of what you've achieved.
You're welcome.
Okay, I think I'm just looking to see if there's any other hands up for comments or questions. I can't see anybody, so I will bring us to a close. But without over-egging the pudding, That was excellent. Absolutely excellent. I really enjoyed that, and I'm trying to think, how do we share that even further? And I'll have that conversation with Craig, because that was just superb. So I'll leave it there. Thank you so much, everybody, and have a good weekend. Bye.
Take care.
Thank you.
Bye-bye.
Thanks, Steve. Thank you.